Hi, Dr. Pamela Frank from Toronto, Ontario, here talking again about PCOS. This is the second in our series. How is PCOS diagnosed? We have something called the Rotterdam Criteria, which is the international consensus that's used by doctors worldwide. To be diagnosed with PCOS, you need to meet 2 out of 3 criteria. The 3 criteria are, 1, you have to have cysts on the ovaries on ultrasound. This one can be a bit confusing because cysts can come and go. And not all cysts are the same. They're not always the classic string of pearls pattern often associated with PCOS. So presence or absence of cysts isn't always the full picture. One ultrasound doesn't always tell us whether you may or may not have cysts at some other point. Secondly is irregular ovulation. This is a tricky one too because most women don't know if they ovulate, and they don't really know that unless they're really trying to conceive. Period tracking apps are just guessing, so don't rely on that to tell you that you're ovulating. Ovulation predictor kits, they only tell us that your body's trying to ovulate. They don't confirm whether you actually succeed. Your periods are irregular, your ovulation is due. Want to know more about tracking your ovulation properly? You can visit my website at NaturopathToronto.ca. There's a whole page about it there. Androgen excess is the third criteria, either through visible signs like acne, hair loss, or excess hair hirsutism, or blood work showing excess androgens. Testing is important, and how we interpret the results is also important. There are 4 different androgens that I would measure, not just testosterone, and we want to look and see whether your levels are optimal or ideal, not falling within what the lab average or lab normal range says. We'll talk more about testing in an upcoming video. Here's what people up. You don't have to have all 3 of these criteria. So you may not have cysts on your ovaries on ultrasound, but you do have irregular periods and irregular ovulation. And you also have blood work or clinical signs of excess androgens. Therefore, you've met those 2 criteria that you need to be diagnosed with PCOS. You do not have to have cysts on your ovaries on ultrasound. Or it may be that you do have cysts on your ovaries on ultrasound, but the blood work came back normal, but you do have irregular periods. So you've met 2 out of the 3 criteria again. So it is a bit difficult sometimes to understand, but out of these 3 criteria, cysts on the ovaries, irregular ovulation, androgen excess, either signs or blood work, you only need 2 of 3. That means you can have PCOS without cysts on the ovaries, you can have regular periods, but not ovulate consistently. All of that still means you may qualify as having PCOS. Bottom line is you need a proper and thorough assessment to really understand whether you have PCOS, what's driving it, and how to manage it. More on testing hormones and next steps coming soon. Talk to you again soon.